heading back to school, so it is time to set up your doctor's appointments so they make sure they are all ready to get back in the classroom.
And joining us now for more is Dr. Kimberly Hansen with the University of Utah Health. Thank you so much for being here.
Yeah, thanks for having me.
Back to school is on the brain for sure, and
Yes.
definitely the health of our kids come to mind. We're talking physical and mental health as well.
Yes, and going back to school is really stressful. It's a good stress, but there's new faces, new places, new academic stressors. So having some sort of a check-in with your kids and your providers will really help them out.
It really is a big change and a big shift each and every year. You're right, everything is new. Maybe you're not in the class with your best friends. Maybe you're nervous about this teacher or that. So what do we need to be doing right at this time? We should be checking in with our pediatrician and asking what?
Yeah, I think back to school check-ins are really important, not only to identify any physical issues, like making sure vision, hearing, everything that could stand in their way, any barriers are identified, but I think having an open conversation with our kids and creating a space where we can have those conversations with our kids and create those moments where they feel safe to tell us what those stressors are and helping them work through it. And then if we feel overwhelmed, reaching out to our pediatricians and asking them for help and resources.
And I love this new partnership and this new clinic that has just opened up, and that is providing a resource for our kids. Let's talk about U of U Health and the West High Clinic.
Yeah. So we opened in February. We know that in school-based clinics across the nation, that kids who have better access and control over their own health care, it makes a difference in graduation and success rates and participation in school. And so the University of Utah Department of Peds and the Salt Lake City School District and their education fund combined together to make this really special clinic that's housed at West High Clinic, and to give kids an opportunity to get access to care they need, especially mental health.
This is huge.
It's huge.
This is primarily talking about ages 12 to 19, who those ages need that special focus. You've been at this for over 25 years. What has it been like to see mental health become more normalized and prioritized?
It's really important because it's such a huge impact on their overall success academically and socially. And so we know that there's ways to help kids. The key is making sure that we can get identification and then create pathways for them to obtain the help that they need. And that's what we're trying to do at West, for sure.
And this is a partnership with Salt Lake City Public Schools. There is also one-on-one relationship. These are board-certified physicians who can identify certain conditions.
Yes. No, we have 10 pediatricians and faculty members that have training in mental health. We also have psychologists who can do neuropsychology testing and group and individual therapy. And we also have psychiatrists on campus that can help with more complicated needs that students may have.
And when you think about if you need to set up an appointment for your kids, you might be looking at a big wait to get in, insurance issues, but here they can walk right in.
Yeah, and that's a big goal of ours, is to decrease out of class seat time and to let them own their own health and tell us when they need help, and to increase screening. Because I think as a pediatrician for a long time, a lot of times I would do the screening, which is recommended, and then there would be long waits to get them in to help. And that's been a really important part of, it's not just identifying it, but it's creating a pathway for them to get the help they need. Because it exists, the help exists.
Can people walk in?
You can't walk in. You have to call and say you want to be seen, but then we call them on a priority-based down from class, or they can make appointments later.
And I hope they're utilizing that and feeling safe to do so. So stigma hopefully going away, which is wonderful. Everything you need right there on the screen. West High School Clinic, thank you so much.
Absolutely, thanks for having me.
And thank you again to the University of Utah for sponsoring this interview.